the epidemiologist who says don't believe everything you hear, and why she's sounding the alarm. No one, not just the elderly, should be thinking about taking a cruise right now. UCLA's Global Health Director, Dr. Anne Rimoin, faces off against travel writer Stuart the Cruise Guy Chiron, who says don't abandon ship or your trip just yet. The Claim and Countdown's coming right back. Coronavirus cases and questions about it continue to spread at this hour, many of them swirling around whether or not to take a cruise, no matter your age. This past Sunday, Dr. Anthony Fauci told Fox News' Chris Wallace that elderly people with pre-existing conditions should not board cruise ships. But the day before that, UCLA's Center for Global and Immigrant Health Director Dr. Anne Rimoin tweeted, quote, "It's absurd that the vice president met with cruise line execs and then announced that cruises will continue. We have explicitly clear data that COVID-19 spreads easily on cruise ships and many high-risk older people will be on board. Politics and commerce are not more important than human lives." Dr. Anne Rimoin joins us live along with the travel expert known as the Cruise Guy, Stuart Chiron. Dr. Rimoin, I'll start with you. Some might say your position is extreme, but tell us why you think it's absurd that cruise ships are still taking off with passengers on their trips.
We have to follow the global data, and the global data is clear. COVID-19, this coronavirus disease, spreads easily on cruise ships. In fact, many viruses spread easily on cruise ships. And as a result, we really need to limit the opportunities for spread. I think that it's very clear that cruises, right now we're trying to limit big gatherings of people. There are many meetings that have been canceled all over the world. And let's be real, cruise ships are like a big meeting of people in cramped quarters, living all together, thousands of people on the size of a football field, and eating together, playing in casinos together, going to shows together. I mean, the truth of the matter is this is the optimal opportunity for disease to spread.
Yeah, I'm sure the coronavirus loves cruise ships. I mean, we saw with the Diamond Princess, which ended up being forced to dock at Yokohama in Japan. I mean, that was a case study for us. There was one 80-year-old passenger, and as the entire ship was quarantined, the final number showed 8 people ended up dying, and I think 700 were infected, including some government officials from Japan. And so clearly this is an issue, but so should nobody be taking cruises right now?
I think, again, we have to follow the data. The data also shows us that you can be infected and shedding virus and infecting other people before you have symptoms. So screening procedures are not going to work. It doesn't matter how carefully a cruise wants to screen people before they get on. People could be sick, and all you need is one person on a cruise ship ill, and they could spread it to thousands of other people. We saw a 20% infection rate on the Diamond Princess.
Indeed.
I mean, it's the ideal environment. So it doesn't matter if you're in the high-risk group or in a low-risk group. It's not a good idea at this point.
Stuart Chiron, you're known as the Cruise Guy, and everybody follows your pieces and your writing about the cruise line industry. When were you last on a cruise?
Well, it was about 3 weeks ago, actually, in the Caribbean. And Liz, I would just say, I mean, you know, based on the doctor's data, we should all dig a hole in our backyard and jump in it, and hopefully at some point, you know, we'll be able to come out and the world will be a safer, better place. But there's data to show all kinds of things, and the reality is that the cruise lines have been dealing with H1N1, Zika, Ebola, SARS, MERS, and norovirus, you know, for decades. And they've learned from these processes. They provide a very safe environment for cruise passengers and crew. I was on a cruise ship a few weeks ago. I saw extensive changes because of what was going on with Diamond Princess on the other side of the world. Well, they had tougher screening. You had yourself, your questionnaires. They were people in the terminal that were looking for people that were visibly ill.
Screening doesn't matter at this point, because if somebody is ill, they may or may not know they're ill. The truth is that people can be shedding virus beforehand, and we also know that asymptomatic infection is a driver of this. So it doesn't matter if the cruise line is perfect.
Princess.
Exactly, and so it doesn't matter if the cruise line is perfect strict in terms of how they want to screen people, whatever it is that they want to do. The fact of the matter is all it takes is one person who has been incubating the virus, who doesn't know that they've been exposed, and the entire
grossly
cruise.
Negligent in the amount of people that have been tested. I mean, what, 1,453 people in this country? I mean, you look at South Korea with 7,500. They've only got 54 deaths. We're way behind this. But the reality is that we know that the cruise ships are a lot cleaner.
The death rate in South Korea right now, the case fatality rate in South Korea right now is less than 1%. The case fatality rate in Wuhan, where they did not implement social distancing and good practices of keeping people away from each other, was actually 5%. So that means that in places where you do not have good social distancing practices in place and you do not keep people in safe environments, you have a case fatality rate that's much higher. We have the opportunity to lower that case fatality rate by making sure our hospitals are not overrun.
Stuart, we got to run, but I want you to have the last word. Cruise or not to cruise?
Well, I would absolutely go on a cruise. I would thankfully, there's no cruises to Southeast Asia at this time. I'd be certainly looking at Alaska. I'd definitely be going to the Caribbean, Mediterranean. I think there's going to be a lot more changes as far as what itineraries may actually wind up happening. But based on right now, I would certainly go on a cruise.
Great to have you both. And it is an ongoing discussion as we learn more about this. Stuart Sharon, the cruise guy, and Dr. Anne Remoyne of UCLA. And my sister-in-law, I'm proud of you. Good to see you. And thank you, Stuart. Join us again. It is a lively discussion that we continue to look at, but we are looking at session highs right now.